think next up is a testimony to how much our industry has changed, how much healthcare has changed. The next inductee for the 2014 Canadian Healthcare Marketing Hall of Fame will be Paul Cusimano, Vice President, Business Development and Infusion Clinic Network at Shoppers Drug Mart. And presenting will be John Szyslowski, President of Shoppers Drug Mart.
Good afternoon. A couple of trivia questions to start. How many of you in the room were here in 2002 for the very first Hall of Fame induction ceremony? A few people. Anybody remember the name of the individual? Very first person inducted, and a bit of it is because of alphabetical order, but the very first person inducted into the Canadian Healthcare Marketing Hall of Fame was Doug Ballingall. You knew the name. And does anybody remember, final question, who did the induction for Doug 12 years ago? The person I'm about to introduce. So 12 years ago, Paul Cusimano was inducting Doug Ballingall, and it's my honor and pleasure to introduce Paul to the Hall of Fame today. Let me give you a bit of history about Paul and some background. During Paul's 40 years in the industry, I don't think there's too many people Paul hasn't crossed paths with. So many of you in this room may know Paul or have spent time with Paul or heard about him. But let me give you a little bit of background, because it is truly one of those really incredible careers that somebody has built in our industry. Paul was born and raised in Toronto and began his career right out of university with one of those global powerhouses you all remember, Arlington Laboratories, for those of you that remember. Paul spent a few months with Arlington before he was recruited over to join Ciba-Geigy. And at the time, and this is, a few years ago now, when Paul joined Ciba-Geigy, he was the youngest representative in the history of Ciba-Geigy. And within his region of representatives, Paul brought the average age of the team down to 17 years of experience. So how the industry has changed over the years. Paul spent about 10 years at Ciba-Geigy, various roles, primary care, hospital representative, into product management, where he had some of his first experience launching products. He then moved over to Bayer, which at the time was known as Miles Laboratories, where he took on the role of manager new business development. He actually launched Adalat PA into the Canadian marketplace, was also very actively involved in the development of Cipro. After almost 13, 14 years in the industry, Paul moved over to the agency side and held several roles in the agency side over a period of about 11 years with SMW, with Gray Advertising, Walsh, and finally with Palmer Jarvis DDB as VP and Managing Director. During that time, Paul actually was quite involved in asthma, and he was approached by the Asthma Society to join their board of directors, and Paul accepted that opportunity and spent 10 years working on the board of directors with the Asthma Society of Canada, including 2 years as their president. In addition to all of his heavy day-to-day responsibilities, the amount of time dedicated to a board, many people in this room would understand that. Paul was then recruited to Hoffman LaRoche, where he spent 8 years, and it's actually where Paul and I first met and worked together. Paul had many responsibilities at Roche over his time in that organization. And it was following his time at Roche that Paul entered into what I'll call the specialty health services side of our industry. And that's where Paul has spent the last 6 years. And in Paul's words, he would say, the last 6 years have been the most personally rewarding and satisfying years of my career because of the absolute direct impact we have on patients' lives living with some of the most complex and difficult diseases to treat in Canada, and I would echo that sentiment. Paul started his specialty services with AmerisourceBergen in Canada, but has spent the last 2 years with us at Shoppers Drug Mart, and I've had the pleasure to have known Paul for many years, and the great fortune to work with him again over the past 2 years. I've known Paul for many years, and I don't think we've had many conversations where family isn't part of the discussion, his mom or dad, but I'm pleased to have here today. I know Paul is as well. Paul's wife Susie is here. His daughter Jennifer, and Kaylee, and Paul's son Lee is unable to be here because he lives in Calgary, and Paul is also the very proud grandfather of 4 grandchildren. He has a very recent fourth grandchild that's joined us. So I think, you know, over the last 40 years, Paul has truly assembled a resume of accomplishments few people in our industry will achieve. And I think the impact that he's made to Canadian healthcare, to the many people he's worked with, to the patients that he's committed to, I think truly exemplify the type of individual we'd want to recognize into the Hall of Fame. So if you'll join me, I'd like to congratulate and introduce and welcome Paul to the Hall of Fame. Come on up, Paul.
Thank you very much, John, for those kind words. I really can't think of anybody else that I would really want to do this, and I really appreciate it. And Mayor Hazel, I want to thank you for being here today. I know you won't remember this, excuse me, but you came into the dressing room about 25 years ago after the boys and I finished playing hockey, and we had a really good chat, and I've always remembered you for that. So thank you for coming. Really appreciate it. 15 sweaty guys and the mayor. It was pretty special. So firstly, I'd like to thank those who nominated me. I really had no idea that this was in the works, so that made it even more special when Mitch called me a couple of months ago to tell me that I had actually been inducted into the Hall of Fame. To say I'm honored and humbled is really an understatement. I know that one of my good friends in the industry, Dale Acorn, had a lot to do with getting me nominated. It takes a lot of industry support these days to get in the Hall of Fame, and I really acknowledge Dale for kind of rallying the troops, and he got a few people to nominate me, a few senior people in the industry. For those of you who know Dale, you might not know that he had his second hip replacement operation on Monday and couldn't be here today. So our thoughts and prayers go out for him. Maybe now I'll be able to beat him at golf. I'd also like to thank the Hall of Fame Selection Committee for their endorsement and congratulate the other inductees, some very, very, very impressive people. As John said, it's a very special thing to have your family here today too, and thank you. Another acknowledgement is to Cliff Goodman. Cliff, where are you? Cliff drove all the way from Montreal. Oh, there he is over there. Cliff was still is one of my major mentors, and kind of brought me up in the industry in a very nice way, I think, and very special feeling that he drove all the way from Montreal to be here. So thank you, Cliff. You know, when I started in this industry in 1974, I really embarked on a journey that would teach me many things, take me to many places, and meet so many people. I even learned how to pronounce iodochlorhydroxyquin after several attempts while training to be a rep at Ciba-Geigy. For a marketing grad, that $50 word didn't come easy. So I've seen the industry from the sales side, the marketing side, the operations side, the business development side, the advertising side, the data side, and over the last 6 years, as John mentioned, the specialty side. I've learned that about the intricacies of several diseases, markets, and products. I've launched several products, observed the cultures of many companies, and have come to appreciate that there's more than one way to skin a cat. I learned that different companies can do things in different ways, and that can all work with varying degrees of success. But I would say the greatest learning experience of my career has been the last 6 years while I've been in the specialty segment of the industry. I've learned more about the Canadian healthcare landscape and the complexity of market access in Canada. And believe me, I talk to a lot of American biotech companies that want to come up to Canada, and they think their healthcare system is complicated until they find out about ours. So the hallmarks of the specialty business are really that they're products that are usually very expensive. It was mentioned this morning in one of the talks that drugs can cost, you know, 20, 50, 100,000 or hundreds of thousands of dollars. And so, you know, these products also need to be temperature controlled, and they require to be, many of them, injected or infused. I've also learned how to design patient programs and meet the differing aspects of the target audience or the different needs of the target audiences. But most importantly, keeping in mind that the patient always received the highest priority. This is really the period, the last 6 years, where I've really become very aware of the fact that what we do can have a direct impact on the positive outcome for a patient. Talking about patients that have cancer or multiple sclerosis, rheumatoid arthritis, patients with rare diseases. Talking about patients that not only after finding out they have a terrible disease, but they find out then that the drug they've been prescribed costs hundreds of thousands of dollars. These patients also require specialized case management and a lot of clinical attention by a qualified nurse to infuse or inject, and also educate them on the pros and cons of the drug and keeping them on the drug. These patients realize they're on an unpredictable journey, and they face many fears regarding their disease, the drug, and finances. In a strange way, I'd suggest that these are the lucky ones because they're being taken care of, but there are many patients in Canada who do not have access to the drug they require because it's not covered. And I've personally seen many patients get very sick and even die because they could not get access to the drug they really needed. So my personal belief is that there shouldn't be any patient in Canada that should be denied a drug that they truly need because it's not covered or they can't afford it. In the specialty business, it's our mission and our passion to gain access to these patients, to leave no stone unturned. And we have very, very many positive stories of very successful outcomes because of the efforts. I've met many patients in the last number of years, and I've seen the relief in their eyes when we tell them that we've secured coverage and we've secured the necessary financial assistance for them. So, ladies and gentlemen, we need to advocate for those with no coverage because there are many patients here that just cannot get their drug covered and simply can't afford the treatment. This is Canada. So, ladies and gentlemen, there's more work to do, and I would encourage all of you in this room to think about what you can do in helping the patients who are the reason we're in this business. Thank you once again for this award.